Belsomra is a medication used to treat insomnia, a sleep problem. It can help you fall asleep and stay asleep longer, so you can get a better night's rest. It belongs to a class of drugs known as sedative-hypnotics. If your insomnia continues for longer than 7 to 10 days after starting treatment, talk to your doctor to see if you need other treatment. The recommended dose for Belsomra is 10 mg, taken once daily, within 30 minutes of going to bed. It is important to take Belsomra only when you are able to get a full night's sleep of at least 7 to 8 hours before you need to be active again. Always follow your doctor's instructions for the best results. Before taking Belsomra, make sure to read the medication guide provided by your pharmacist. Take Belsomra by mouth as directed by your doctor, usually 30 minutes before bedtime. The dosage is based on your medical condition and other medications you may be taking. Be sure to inform your doctor and pharmacist about all the products you use. Do not take a dose of Belsomra unless you have time for a full night's sleep of at least 7 hours. Do not increase your dose, take it more often, or use it for longer than prescribed. Avoid taking Belsomra with alcohol or other drugs to help you sleep. If used for a long time, Belsomra may not work as well. Talk to your doctor if this medication stops working well. Belsomra may sometimes cause addiction, especially if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. Tell your doctor if your condition lasts after 7 to 10 days, or if it gets worse. Remember to always consult your doctor or pharmacist for more details and any concerns you may have. Some people may experience unusual dreams while taking Belsomra. If this persists or worsens, it's important to let your doctor or pharmacist know. Belsomra may cause drowsiness during the day, so be sure to inform your doctor if you experience this. Your doctor may need to adjust your dosage. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who take this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects, such as changes in mood, temporary weakness in your legs, sleep paralysis, or if you engage in activities while not fully awake, such as driving, sleepwalking, preparing food, making phone calls, or having sex. This is especially important if you consume alcohol or other medications that cause drowsiness while taking Belsomra. While rare, a serious allergic reaction to Belsomra can occur. Seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Belsomra, let your doctor know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions. Talk to your pharmacist for more details. Before using this medication, tell your doctor your medical history, especially if you have certain sleep disorders, liver disease, breathing problems, mental/mood problems, or a history of substance use disorder. The effects of Belsomra can last even after you wake up the next day. If you did not get at least 7 hours of sleep or took other medications that made you sleepy, you may not think clearly enough to drive. Alcohol or marijuana can also make you more sleepy. Wait at least 8 hours after taking this drug before driving, and do not drive or use machinery until you can do it safely. Avoid alcoholic beverages. If you take the 20 mg dosage of Belsomra, do not drive or use machinery the next day. Before having surgery, tell your doctor about all the products you use. Older adults may be more sensitive to the side effects of this drug, especially confusion, unsteadiness, and excessive drowsiness. This may increase the risk of falls. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. It is unknown if Belsomra passes into breast milk. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Belsomra works in your body. Certain medications can impact the removal of Belsomra from your body, which may in turn affect its effectiveness. Examples of such medications include certain antifungals, drugs used to treat seizures, HIV protease inhibitors, and others. It's important to discuss with your doctor or pharmacist all the products you use, including prescription and non-prescription drugs, as well as herbal products. Taking Belsomra with other products that may cause drowsiness or breathing problems can increase the risk of serious side effects. This includes opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, and antihistamines. It's important to communicate with your doctor or pharmacist about any other products you are taking. Additionally, be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's always best to ask your pharmacist about using those products safely. If someone has taken too much Belsomra and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of overdose may include being in a deep sleep that you cannot be woken up from. It's important to always take medications as prescribed and not exceed the recommended dosage. It's important not to share Belsomra with others, as it is against the law. As we age, our sleep patterns may change and we may experience interruptions in our sleep. It's best to consult with your doctor or pharmacist for non-medication methods to improve sleep, such as avoiding caffeine and alcohol before bedtime, avoiding daytime naps, and maintaining a consistent bedtime routine. If you forget to take a dose of Belsomra, don't take it unless you have enough time to sleep for at least 7 hours afterward. It's important to make sure you have enough time to sleep to avoid any potential side effects. It's important to store Belsomra in its original package at room temperature, away from light and moisture, and not in the bathroom. Keep this medication out of reach of children and pets. When it comes to disposing of Belsomra, do not flush it down the toilet or pour it into a drain unless you are instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Belsomra. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.